Good morning.
Morning.
Professor Makasa, a legend. How would you describe the current state of healthcare in Zambia, and what are the challenges that are facing?
Yeah. So healthcare in the country is present, but it's not present to the extent that everybody wants. The government obviously wants to do more than they are doing. We have a very narrow or small private sector, so their role is very limited, and it's really mostly in the urban areas. We have other partners that are also helping us in the rural areas, like faith-based organizations, but even they are not reaching everybody that they need. In terms of our systems, we still have limitations in many areas. Our infrastructure is not fully up to what it should be, and it's not every space that has appropriate infrastructure, especially the rural communities. They are always kind of disadvantaged. Our human resources, we have tried to train more, but we still need to place them properly, train them in appropriate skills that they need. And even the numbers are still not okay, but we also have challenges of absorption. We may train and we have limited capacity to employ them. In terms of the tools that we use, we don't manufacture anything, as you know, in Africa. So we always have to rely on supply chains that sometimes are disrupted. Sometimes we also don't have enough resources to actually procure those equipment and tools that we may need. Maintenance of some tools sometimes is also a problem because our biomedical engineering is also really limited. Information about the burden of disease and what we are doing is also limited. So we're doing something, but we're not where we need to be. And our goal is to try as much as possible to provide good health and well-being for everybody.
I think we might both agree that a robust healthcare system is the foundation upon which everything is built. So economy, education, employment. So Zambia needs a healthy population.
Yes.
So what needs to happen now in order for us to achieve a healthy population by overcoming the barriers you described earlier?
There are many things that we have to do. Obviously, the lead is government to not only lead us, but also to create an enabling environment that will enable that. The other part also is a mindset change from the population themselves, because nobody can force you to be healthy. You yourself have to be convinced that you need to be healthy, it's good for you, and then you start investing in things that can make you healthy, your own behavior, your own choices. That is really important. For me, it starts with the mindset of everybody, the mindset of the population. The mindset change may need a lot of other things to do that. One of it being education. They need to understand and appreciate their roles and the risks that they have in the environment. And then the government and other partners have to create an enabling environment to facilitate that. You may want to be healthy, you eat well, but you want to monitor your BP to ensure that you're not hypertensive. But if there's no one to teach you how to do it, to measure that BP, or there's no facility where you can go and actually have that BP or sugar measured, then it becomes a problem. We also have to try and bring down the other things that force people into picking a healthy lifestyle. Poverty is a big driver of people into unhealthy lifestyles. People choose to do certain things not because they want to, because the poverty pushes them into that. The choice of food that they eat. Yeah. They may be eating junk food instead of eating healthy food because it's expensive. Yeah. They may be eating junk food because they can't even grow their own food because they're living in a squalor where there is nowhere space to grow any food. They may be drinking beer because they are stressed, because of their workplace or because they don't have a job. So there are many things that could push people into unhealthy lifestyles, and we have to try and, together, government and other stakeholders, to try and reduce those risks that would push people into picking or going into lifestyle and making choices that are against their health. So it's many, many things that we have to do.
Yeah. Do you think that the current model, which sees almost half of Zambia's overseas aids going on health, do you think it's making life better or worse for the people of Zambia?
I think that the people are not where they should be in terms of healthy lifestyles or even just their health. As you can tell from our disease burden, we're not doing very well in many aspects. Our disease burden are not good, but even just management of those diseases once they arise, we're not doing it as much as we should. We're still working in silos. We're not efficient in the use of the resources we have and the facilities we have. And our partners, even if they provide support, they are kind of blind to some of the needs that we really need. Yeah. You know what I'm saying? sometimes that support, even if it comes, it's earmarked. So it has specific objectives. And it doesn't allow us to be flexible and use it the way we want to use it.
Yeah.
To achieve what we realize and what we know can really work. So there are all those, factors. It may look like a big budget, but some of the money also is just boomerang through us. A certain partner can say we're giving so many millions to Zambia for this purpose, but it's actually to provide support for their own industry to provide us with the materials.
Yeah.
So you can say you're giving us money, for example, for ART. I can choose an example of HIV. Even the Global Fund has put a lot of resources into HIV. But have they built capacity so that we are sustainable, so that tomorrow if the donors don't want to give us money for HIV, we can sustain and continue? No. We still have to buy reagents from them. We have to buy the machines from them. We have to buy the drugs from them. Even for malaria, we even have to buy nets from them.
Yeah.
So all those things don't support. They may look big when we make the budget or on the paper, but in reality, the money is not here. It's coming through us, through our name, like a contraceptive and going back right to whoever gave it. Yeah, we're not happy with how global health financing is done and how the monies are dispersed or actually used. Because if you really want to help, which is the spirit of financing or support, unless it's even if it's basically if it's a grant, it should prioritize our needs.
Yeah.
Even the receiving governments never really discloses those hidden details, like I said. So it's like you're giving what at the same time when you're taking it away. If you want to help my family, you should listen to me. I can explain to you where we are. I can give you our priorities and how we want to work. You can advise, you can be part of the solution, but you should not tell me what you want. So most of the money we see is always earmarked. There's only a set objective set by whoever is giving it. But that's not the only issue in terms of partners coming from outside. We should have partners here. We have businesses here. We have wealthy people here. Where are they? Why are they not taking up this responsibility? Because again, when we leave it to others just to help you all the time, that's why we're facing these problems. We ourselves also should learn and start standing up. I mean, when are we going to stand up? We've known this for years, but we're still making very little effort to be able to stand up on our own, to try and do certain things for ourselves, even mobilize resources within ourselves, and then channel those resources where they should be. The other issue also is that health is business. It's big business for a lot of industries. Everything we use in health, from my scrub, my shoes up to my cup, is made by a company. Okay? Even medications, even reagents. So sometimes certain entities or NGOs or groups have got other partners behind them who provide that support. And if they can completely eliminate whatever issue that they are focused on, what's going to happen to them? If you finish malaria, what's going to happen to the drug producing companies? They will run out of business. So there are also hidden things that people don't see that drive the agenda.
And we hear that a lot.
Yeah. And people don't want to finish the problem because otherwise then they'll run out of business. There'll be no jobs for them. That also should be recognized.
Yeah. So speaking directly to international aid organizations now, would you say that they are listening to what you want?
I mean, we have this discussion, like you say, have been discussed at many fora within the UN system, at WHO, at the World Trade Organization. That's why we even came up with the TRIPS agreement. So they've been discussed before. Our concerns have been tabled, maybe not as much as we should, because again, these meetings don't take place in Africa. They don't take place here. They take place in Geneva, they take place in New York, they take place far away from here where the real people who should be talking are excluded. The politicians that may come there may not know the agenda, they're not technical, so they may not be able to argue and discuss like I can with other partners. So they can easily be brushed aside, or they can just make a statement and it ends there. It never ends just with making a statement and you think you are heard. You have to follow through something. This is an experience I had with the resolution on surgery. It's not something that happened in a day. No. It is something that I had to follow. Even when we had the resolution up to now, very little has been done when we have a resolution in place. So where the discussion takes place is important. And our colleagues on the other side, whatever little effort we've made, I think they brush us aside. They say, yeah, we agree. And then when we leave the table, nothing changes. Yeah. So we don't think that they are helping us. And we are in desperate situations. I don't think we have to die for them to understand that, we have to coexist. We're here. We're human. Yeah. We don't want to kill their businesses, but we need to get our people to a certain level of good health and well-being.
Let's pretend we're in a parallel universe and all the funding that comes from international aid was unrestricted, and you were told to spend however you want on healthcare, what would you do?
What our people needs good health and well-being. It has two components. There is the public health component and there's a clinical component. Okay? In public health, like I said, to change, the health starts with the individual. We have to get to empower the individual to know about their risks and the right behaviors that they should take and the preventive measures that they should take so they are healthy. Mm-hmm. That we have to invest in that, but at the same time we also have to invest in the clinical component of care, because there are those that have conditions that are not because of their fault, because they misbehaved or anything. They were born with it, maybe they were in a road traffic accident. If you're in a crash, it's not always your fault. Here in Zambia, we always say when you're driving, assume the other guy is drunk, because it's not always going to be up to your driving properly that you won't have an accident. You can have an accident even when you're following all the rules. So it's not always up to you. Now, for those people that are afflicted with different health conditions, I think the service should be prompt, should be timely, should be appropriate, should be safe, and should be as close to them as possible, which means we have to really invest in the health system for the clinical component so that it's closer to the population, so they can be able to get what they need on time. That's what I would invest the money in those two. So I would ensure that the public health is okay, and I would ensure the clinical component is okay for the people. And we can, of course, unpack each one of those into many, many components.
Well, let's move on to more specifically surgery. You championed the case of surgical care as part of universal health coverage at the World Health Organization.
Yes.
Why in your mind is surgery so important?
Surgery is quite important for me because surgery is not one thing. Surgery is a tool that supports everything in the health system. It supports everyone throughout their life course. Everybody needs surgery before you are born, during birth, after you are born, when you are growing up, when you are a teenager, when you are working, even when you are old, you always need surgery somehow. Mm-hmm. And then surgery is not something we put in pediatrics or in children or in the women's health or in NCDs or in infectious diseases. No, it cuts across all disciplines and all vertical programs that we've set up. Surgery is something that strongly improves the health system. You cannot provide safe surgery without having safe anesthesia. And it's not only surgeons and surgical patients that need anesthesia. COVID patients need anesthesia. Critically ill patients may need anesthesia and life support, which the anesthetists provide. You cannot provide safe surgery without blood transfusion, safe blood transfusion services. And again, it's not only the surgical patient that need it, but when we improve it for the surgical patient, all the other patients who have access to it. You cannot provide safe surgery without reliable lab support. We need to know how your body is functioning, your kidneys, your liver, your pancreas, your blood picture, everything. So if we improve that lab support for surgery, it's not again only going to be the surgical patient or the surgical workers that will need that. Everybody will need it. We can go onto imaging. It's not only the surgical patient that needs imaging, X-rays, ultrasound, MRI, CT scan. No. And surgery also helps to achieve certain health outcomes. The whole world has been struggling to reduce maternal mortality. From what we know, maternal mortality, the biggest chunk of maternal mortality is caused by things that relate to bleeding. There'll be a tonic uterus or a laceration or, and it's surgery that gets you to solve that problem. But people have thrown money into contraceptives, abortion, and a lot of other things. But nobody's really providing the space where surgical interventions could be done for those mothers that are in danger of death because of the complications that arise.
I always thought it was odd that you could have a situation where millions is invested in disease-specific interventions, yet a child can, we can cure a child we can vaccine a child against polio, but then they walk out in the street and get hit by a car and they break a leg and they live their entire life
as a disabled person,
as a disabled person, and just the impact it has on that child's entire life. Yeah,
so that's what we've been trying to make others understand, that investing in surgical care is investing in everything. investing in safe surgery, if it can be as close to the people as possible as the district hospital, is investing in health system strengthening. We can explain to you how, with surgical improvement, we improve the health system. We want good health outcomes in all areas. People invest a lot because they want to reduce this to this, they want better indicators. But again, let's be real. Because sometimes we can pour as much money as possible to a certain thing and it won't, like I said, with maternal mortality, it's not going to go beyond a certain level without improving the surgical capacity that supports it. In cancer care, surgery is essential from the diagnosis. You can't know what cancer you have, especially in solid tumors, without taking the tissue. That is surgery from the diagnosis. Sometimes we have to remove that part so that it doesn't spread too much. And even when we have removed that part in palliative care, we may need surgery. So you cannot run away from surgery in cancer care. You have to invest in it because it's something that supports the whole comprehensive cancer care. But we're not seeing that. We're seeing people putting up radiotherapy, chemotherapy, and nothing for surgery. Yeah. And yet they expect better outcomes in cancer care. It's not going to come.
Yeah. So a child essentially with cancer could have the chemotherapy treatment, and then the surgery that's required at the end doesn't happen.
Ideally, they should have, first of all, after we take the tissue and we diagnose what cancer it is, normally we will get rid of the part. It could be an excision, it could be a total or a partial, but we have to get rid of the source of those cancer cells so that there is less cancer cells inside that can then be cleared with chemotherapy. You can't start, sometimes we may start with chemotherapy, yes, just to reduce the size of the mass so that it's easier to remove it, but eventually still we have to get rid of the source. And surgery is, you can't run away from it.
And would it be safe to say that not every individual in Zambia today could access surgery if they needed it?
Yeah, of course, no.
No?
No, not at all. Because surgical services are only at the tertiary levels of care. Yeah. And we have this one. And the secondary levels of care, limited, not even as much as, even here, for example, we are struggling to meet their backlogs. Even the emergency patients, they come in as emergency, they're never treated on the day they come. They'll join the backlog, if their condition is not very life-threatening. So we are not satisfying the need of the people within this catchment area in the tertiary level. Yeah. And we have a lot of surgical staff here. And then when you go to the district, to the province, we even have limited because there may just be one surgeon or two surgical staff. They may be there, but there's no anesthetist. The anesthetist will be there, maybe no operative nurse. When we go to the district, we have 106 districts. Surgery doesn't even take place. So, the people are not receiving the care that they need in surgical care.
It was a bit of a loaded question. I figured you were going to say that. But I guess where I was going with the question was, here's the WHO who have published these building blocks for a stable health system. Yeah. Clearly, that's being ignored by donors. So I'm going to ask you why you think it's being ignored by donors.
I doubt that the donors are ignoring them. I think that they pick and choose what is good, what they can work with. For example, most of the donors don't want to pick capital investment things. So the infrastructure development, usually, most donors don't want to do that. They want that to be, even when you get funding, they'll tell you, no buildings. You can't build a new structure with that money. Mm-hmm. So usually the donors don't want to have to do the heavy duty, lifting for you.
KidsOR are acutely aware of the fact that 9 out of 11 children across all low middle income countries cannot access safe and timely surgical interventions. Yes. Tell me a little bit about what the impact of that gap in healthcare is having on the children of Zambia.
It is really sad, and it's really because, as you know, we start with demographics. Children are the biggest component of our population. They make up about maybe 52%, if not more. Mm-hmm. So they're a huge constituency. They're a really big constituency whose needs need to be addressed. And the way our health system has been developed and built, first of all, it starts in the urban areas. It has not gone to all rural areas. And it's mostly primarily focused on adult health, not children's health. Yeah. But children have a lot of problems as they are human beings too. They'll have infections, injuries. They even have developmental problems, So they need more help. Now, the impact of not having good health for children has impact on their health because we will lose a lot of them to unnecessary death, preventable deaths. Those that survive are sentenced maybe to a life of long-term morbidity and with disability when it comes to surgical disease.
Yeah.
The disability sometimes is they are born with it, like for example, clubfoot and a lot of other things.
Yeah.
Or if they have fractures and they're not really fixed properly, then they end up disabled. There's segregation that comes with disability in communities. In this part of the world, we need our limbs, both arms and legs, to actually earn a living. We have to walk to work. We have to use our hands to work. The children themselves still have to get an education. Education does get people out of poverty somehow, but the schools are always far placed. If a child can't walk because of a disability, then of course their school attendance is going to be limited. And if that is the case, then of course their future in education is really bleak. And if they can't get an education, what's going to be their life like in the modern world? So the impact is huge, not only in the health, in terms of death. More children are dying because we're not doing enough for them. They're living a miserable life as they grow up because they're sick all the time.
Yeah.
They're ending up disabled when they shouldn't. And it's affecting other aspects. It's closing off all the opportunities for them in the life that they could have later on as adults.
Yeah.
Yeah.
And the impact, let's not forget the impact on the wider family, the siblings, the parents, the...
Yes, of course. Then
all
there's dependency.
all
and,
that,
you know,
that
with
on,
extended
goes on top
family
of just the
system
child.
here, yes. So when one member of the family is sick, as you know, everybody comes together. So everybody will be focused on that child when they shouldn't. With a problem that could have been solved, for example, if it's a fracture, we could solve that in 2 hours here in theatre, and the problem would have, but they would be dependent on the whole family. And then the children are also the future of any nation.
Yeah, of course.
If you have unhealthy children, poor performing children, I doubt that you're going to develop as a country, because where are you going to get the human capital?
Yeah.
We have to invest in our own people, because that's the future.
I think it's important to always ask the recipients, and let's say you're acting on behalf of the recipients of our investments, could we do things better? Is there things that we haven't got quite right, or do you think there's stuff that we could, in a constructive, helpful way, is there stuff that you could say that we could do better as an organization to support the surgical, this capacity building in Zambia?
I don't think it's a matter of doing things better. It's probably, could you do more? For me, it's a matter of, can you do more?
Yeah.
Because the way you've done things, the way you've engaged with Zambia and with the health system in Zambia, I don't find it, personally, I don't see any problem with it, and I don't see anything wrong with that. So there's nothing wrong you have done as an organization. The investments you've made were based on our requests. What we asked of you to do is what you did. Mm-hmm. And even how you did it, it's not like you airlifted some whole team from Scotland and set it up here and so they do everything. No, we were involved. We had contractors here to be involved, so we were involved in everything. So that is not really a matter of you doing anything better. I think what I have probably would be, could you do more? That's what I would probably ask. And then of course I can go into details of what else we can do together so that we can do more. Because as you know, 3 operating theaters in 2 districts and 2 trainees being supported is a drop in the ocean. It's a big investment.
It's scratching the surface.
Still, compared to what we really need, is still something. So there's room for us to do more.
Well,
together.
Look, in Scotland, which has a population of maybe 3 million people under 20, I think we have 24 pediatric surgeons. You know, for a tiny, small population of children compared to what's here, and clearly it's underserved, and we do need to invest. You know, we're trying to do things as quickly as possible. We're pretty quick at getting things done, and but I assure you we will continue to support you and the government here to invest further in the country, but also importantly making sure that our existing investments remain maintained in good working order, that there's not a degradation across the materials, and that will require further investment. And
that's true, yes. For me, if I was just to pick off one thing off my head, is that we need to map out the burden of pediatric surgical disease in the country. That is something that we can easily do together. Yep. Because if we don't know the extent of our needs in terms of burden of surgical disease, it may be difficult for us, even ourselves as a country, to move forward alone or to even look. So we need to understand our challenge. How big is the challenge? And then we also need to ensure that children's surgery is a priority in the policies that we are making. So we may not know everything about children. You may have a lot of other partners, jigs and other, who are into pediatric surgery. As you know, the pediatric surgery team here is really small, so they cannot really address that. So we would like participation through you from other stakeholders that are involved in taking care of children conditions. So in the policy that we formulate, we can prioritize and put the appropriate things there so that year 1, year 2, year 3, we can be seen to be making progress. So those are some of the new little things that probably could help us in the medium short term. The other bigger things, of course, we can always collaborate and discuss. But for us, now that could be a good thing, and I would like to invite you to be a key, like the minister invited you yesterday, be part of us mapping out the extent of the burden of surgical disease in the country, so we know what we'll have to deal with. And then be part of that policy formulation that we're going to renew, so we can ensure that we give children, who are a big portion of our population, the right space, the right allocation, and the right resources, so we can then start chipping up and eliminating those barriers that are in the way.
So if you had a message for anyone donating to healthcare in Zambia, me and my KidsOR included, but any other donor, what advice would you give us as a group so we can genuinely help?
The first thing is that sometimes don't wait for us to ask. If you can see that we are in need, we are always mostly in need. We can't always come to you. We are limited in access to Europe, to the high-income countries.
Of course.
We can't travel, we have restrictions, we have a lot of things. So be willing to come, first of all. Come and see where we live, what we are living through, so that it will be easier also for us to speak to you. And then, secondly, when you come, let's have a discussion. I know that when we have different financial positions, there's power balance, issues that come to play. But come like you have come to me. Let's talk so that we can tell you about the myriad of challenges we have. We can work together to prioritize, and then you can pick, if you should, 1 or 2 or 3 things that you think is, because you also have to work on things that are pleasing to you. Your help should make you happy. You have to be happy about your help. Actually, that's the whole essence of giving. We give people not necessarily because it makes them happy. It's also because it makes us happy when we make somebody happy. So it's about listening and hearing what are the needs, working with us so that you understand what our needs are, so that we can then prioritize together, and then we can invest together, we carrying it through, you providing whatever resources you may provide. Maybe human resource, it may be financial, it may be technical information, and it may be technology. So our needs may be different based on whatever it is that we have to work on. But it's about needs. We have to work on the true needs that the people want. And again, it's not always a matter of just talking to us as the health workers or government. We are privileged. The patient may give another picture. So it's important for us to also be very inclusive when we discuss with partners like yourselves, so that we can also bring the voice of the patient, the children, so that they can say what problems they have and how they see it from their side, so that also can be addressed. So it's a matter of really being on the same page. If we're on the same page, then it's easier for us to move.
If you were king for the day, not that you have a royal family here in Zambia, but let's say you were king for the day, what would be the one decision you would make to improve the healthcare? And you've touched on all of this throughout the day, but what's the one decision you would make to improve healthcare in Zambia?
I would be a bit radical, because some of the things I can.
Well, you can be because you're king.
Yeah, even the king has to be radical, because some things need radical change. I would really want to focus on improving the health system with real things that support, to be efficient as well as, you understand? I don't know if, the needs are many. We have to prioritize, yes. But if we can improve the health system in a way that is very efficient and cross-cutting, then we'll be killing many birds with one stone. And I also have to work on the mindset of my own people, the health workers and the population, because I think there is also a problem there. Our mindset and how we approach things is not going to get us far. We need to change, we need to realize the world we are living in, and we also need to value our lives and the life of everybody else. So mindset change is something I really work on. And then I have to strategically anchor certain sectors of the economy or the country. You know, health is a must. Health is the beginning of everything. Without good health, there can be nothing else.